Hi everyone, welcome to my class. The topic of my class today will be the ethics of research with children. So I want us to look at the ethics that are required if you were to carry out research on young children. The efforts to improve the health of children depend on clinical investigation that use children as research subjects. Children are a vulnerable population, however, and so as accorded special protection from research risks. Hi everyone, welcome to my class. The topic of my class today is the ethics of research with children. We shall be discussing about the ethics, particularly those researchers who would like to carry out investigations and do research on children. Efforts to improve the health of children depend on clinical investigations that use children as research subjects. Children are a vulnerable population, however, and so are accorded special protection from research risks. Researchers in pediatrics may encounter conflicts between protecting the children who are vulnerable research subjects and developing generalizable knowledge to benefit children as a class. Furthermore, there are many pitfalls for the researcher in carrying out the communication with both parents and children that is required for responsible decision making about participation by children or adolescents in experiments. There is a long-standing moral and legal tradition that supports parents as the primary decision makers for their minor children, including the right to make proxy decisions for children about participating in research. Parental decision making is a critical factor in the study of pediatric research ethics, even though it is recognized that parents, as well as health researchers, may have interests that conflict with the best interest of the child. Today, the legitimate role of the child in decisions about research participation is recognized. The ethical concept of consent provides a framework to assist investigators and parents with efforts to incorporate the views of children who are recruited as research subjects. Now, I want us to look at the ethics, the parents. I want us to look at the parents as the primary decision makers in research, in children research. Historically, the rights of parents over children were grounded in the property rights of fathers. Children were little more than paternal property. So fathers exercised nearly complete control with few, if any, external limits. Today, several other reasons have emerged to explain why parents are considered the most appropriate decision makers for their children. First, parents are responsible for the welfare of their children, and this implies not only the right, but the duty for parents to make decisions on their children's behalf. Secondly, parents are the parties who live most closely with the consequences of their child rearing decisions. Thirdly, parents teach their children values, and as a consequence, it is highly likely that the child will have the value commitments that resemble those of their parents. And lastly, society gives moral weight to the maintenance of family life and recognizes the need to protect those relationships from outside interference and any harm on the children. So let's look at the ethical issues in human subject research. There are several ethical issues that must be considered when designing research that will utilize participants who are human beings. The primary concern of the investigator should be the safety of the research participant. This is accomplished by carefully considering the risks, that is, benefit ratio, using all available information to make an appropriate assessment and continually monitoring the research as it proceeds. The scientific investigator must obtain informed consent from each research participant. This should be obtained in writing, although oral consents are sometimes acceptable. After the participant has had the opportunity to carefully consider the risks and benefits and to ask any pertinent questions, informed consent should be seen as an ongoing process, not a singular event or a mere formality. The investigator must enumerate how privacy and confidentiality concerns will be approached. Researchers must be sensitive to not only how information is protected from authorized observation, but also if and how participants are to be notified of any unforeseen findings from the research that may or may not want to know. The investigator must consider how adverse events will be handled, who will provide care for a participant injured in a study, and who will pay for that care are important considerations. In addition, before enrolling participants in an experimental trial, the investigator should be in a position, in a state of what we call equipoise. That is, if a new intervention is being tested against the currently accepted standards, the investigator should be genuinely ascertain which approach is superior. Now, at this juncture, I want us to look at the components of an ethically valid informed consent. For an informed consent to be ethically valid, the following components must be present. 1. Disclosure. The potential participant must be informed as fully as possible of the nature and purpose of the research, the procedures to be used, the expected benefits to the participant and or the society, the potential of reasonably foreseen risks, stresses and discomforts, and alternatives to participating in the research. Number 2, understanding. The participant must understand what has been explained and must be given the opportunity to ask questions and have them answered by one of the investigators. The informed consent document must be written in a lay language, avoiding any technical jargon. Voluntariness. The participant consent to participate in the research must be voluntary, free of any coercion or promises of benefits unlikely to result from participation. Competence. The participant must be competent to give consent. If the participant is not competent due to mental status, disease, or emergency, a designated surrogate may provide consent if it is in the participant's best interest to participate. In certain emergency cases, consent may be waived due to the lack of competent participant and a surrogate. And lastly, the consent. The potential human subject must authorize his or her participation in the research in writing, although at times an oral consent or assent may be more appropriate. And lastly, I want to address the issue of deception in doing research. As a general rule, deception is not acceptable when doing research with humans. Using deception jeopardizes the integrity of the informed consent process and can potentially harm your participants. So, and that marks the end of my class, which we have been looking at the ethical issues in research with children. So this class is particularly very important, especially those who are doing research on young children. Thank you and bye-bye.